An alarming new study suggests people with COVID are likely still contagious after day 5 of isolation. That is in contrast with the CDC's guidelines that call for just 5 days of isolation if you test positive. Ground 4's Gayle has details and reaction from local health experts.
The CDC knew, and we all knew, that this wasn't going to be perfect if you said 5 days. If you say 10 days, it's not perfect. There still will be a small, very small percentage of people who will still potentially be contagious after 10 days. So you can't let the perfect be the enemy of the good here.
Dr. John Schwartzberg, UC Berkeley infectious disease expert, referring to a recent study posted in preprint, not yet peer-reviewed, suggests people with COVID-19 are likely still contagious regardless of symptom status after day 5 of isolation. Dr. Schwartzberg not surprised by the data.
If you have a positive rapid test after day 5, even if your symptoms are gone, you're still contagious. And you need to do everything you can to prevent spreading that virus to other people. Ideally, it would be staying in isolation. That's what the studies showed about healthcare workers.
The interesting thing about this study is that it's looking at how long basically the rapid antigen test stays positive. The pink line stays positive. But that isn't actually the best measure of viral load.
Dr. Monica Gandhi, UCSF infectious disease doctor, supports the CDC's 5-day guidelines and says COVID tests are not perfect.
Your rapid antigen can stay positive, but it doesn't mean that your virus is alive. It's just picking up antigen. So the problem is with interpreting from these rapid antigen tests without doing culture is that you can look like you're positive and you may not be.
Both health experts acknowledge data is always changing.
A PCR can pick up a little bit of virus in your nose and it can stay positive for 90 days. And the rapid antigen tests do not tell you if you're infectious because they don't culture the virus. So we have limitations of both type of tests. In a perfect world, we'd actually culture out the virus from your nose and see if you're infectious, but that's too hard to do. So imperfect tests, I think 5 days is prudent.
I have several friends who have had COVID, like all of us have had friends or ourselves have had COVID. And many of them have continued to test positive after day 5, some after day 10. And I've told them all, if you're testing positive by the rapid test, you have to consider yourself still contagious.
Gayle, Ground 4 News.